You've been told that inflammation is the enemy. It's in every wellness headline, every supplement ad, every article promising to fight it, reduce it, calm it, as if it were a single villain lurking in your joints, slowly wrecking them as you age. Here's what almost nobody tells you. Inflammation isn't actually the enemy. It's one of your body's most important tools, and without it, a simple sprain would never heal, and a splinter in your finger would fester forever. The real story of joint pain after 60 is more specific, more interesting, and honestly more useful than inflammation bad, fight it. So today I want to take apart several beliefs men carry about their aching knees, hips, and hands, and replace them with something you can actually use. Let's get into the myths. Let's start by rescuing the word itself, because this is the root of so much confusion. The myth is that inflammation is uniformly harmful, something to be eliminated entirely. The truth is that inflammation is your body's emergency repair crew, and in its short-term form, it's essential. Twist your ankle, and inflammation is what rushes blood, immune cells, and repair material to the site, causing the swelling, warmth, and redness you'd recognize instantly. That's not malfunctioning. That's your body doing exactly its job, and without that response, injuries simply wouldn't heal. The actual problem, the one worth understanding, is a different animal entirely. Low-grade, chronic inflammation that never fully switches off. Instead of a short, useful burst that resolves once the repair is done, it becomes a low background hum running for months or years, and that kind genuinely does contribute to joint deterioration and a long list of other issues over time. So the honest version of myth 1 is this. Acute inflammation, the kind after an injury, is your friend and shouldn't be feared. Chronic, low-grade inflammation, the kind that never resolves, is the one actually worth addressing. Lumping them together as one enemy misses the entire point. Here's a myth that stops a lot of men from even asking questions, because they've already decided the answer. The truth has two parts, and both matter. First, arthritis isn't one single thing. It's a general term covering quite different conditions with quite different causes. The most common form by far in older adults is osteoarthritis, which is largely mechanical wear on the cartilage that cushions your joints, built up gradually from decades of use, old injuries, and extra weight bearing down on weight-bearing joints like your knees and hips. This kind does involve some inflammation, but it isn't primarily an inflammatory disease the way people often assume. There's a second, much less common category, though, called inflammatory arthritis, rheumatoid arthritis being the best-known example, where your immune system itself mistakenly attacks the joint lining, and this is a genuinely different disease with a genuinely different treatment path. Telling these apart matters enormously because they're managed in very different ways. And second, nothing to do about it is simply wrong for either kind. There is a great deal that can be done for both types, and we'll get to exactly what shortly. The fatalism baked into this myth causes real harm because it stops men from pursuing things that would genuinely help. This one feels like plain common sense, and that's precisely why it's worth challenging directly. For osteoarthritis specifically, the most common cause of joint pain in our age group, the evidence has shifted firmly against blanket rest. Movement, appropriately dosed, is now considered one of the best things you can do for an arthritic joint, not the enemy of it. Here's why. The cartilage in your joints doesn't have its own direct blood supply the way most tissue does. It gets its nourishment largely through the motion of the joint itself, a kind of pumping action that circulates fluid in and out as you move. A joint that's rested constantly is a joint that's poorly nourished, and the surrounding muscles that support and protect it weaken from disuse, often making the pain worse over time, not better. That doesn't mean push through sharp, acute pain, and it doesn't mean ignore a genuine injury. It means the old instinct to simply stop moving a chronically sore joint is often precisely backwards for the most common cause of that soreness, and gentle, appropriate movement is usually part of the actual solution. Here's one that swings too far in the opposite direction from the miracle food hype, dismissing food's role entirely. The truth sits in the middle, and it connects directly to something we discussed a couple of videos back. Extra body weight places significant mechanical stress on weight-bearing joints, your knees and hips especially. So weight matters here in a very literal mechanical sense, not just a metabolic one. And a diet pattern high in refined sugar and processed food is associated with more of that chronic low-grade inflammation we talked about in myth 1, while a pattern built around vegetables, fruits, whole grains, and healthy fats, similar to what we've recommended for your heart and your prostate, is associated with less of it. I want to be honest about the limits here too, though, because overclaiming is its own kind of myth. No single food, no matter how it's marketed, will dissolve arthritis or regrow cartilage. Diet is a real supporting piece of the picture, not a cure hiding in your grocery store. Be skeptical of anyone claiming otherwise. And the myth that's cost men the most money over the years. Glucosamine and chondroitin, sold together or separately, are among the most heavily marketed joint supplements out there. The honest research picture is disappointing, and I have no product waiting at the end of this to color my answer. Large, well-designed studies have generally found these supplements perform little better than placebo for most people with osteoarthritis. Some individuals report feeling better, and that's worth acknowledging. Placebo effects and individual variation are real, but you shouldn't expect these to reliably outperform the basics we're about to cover, and you shouldn't spend serious money assuming they will. If you want to try one and it's not interacting with any medication you take, that's a low-risk decision. Just keep your expectations calibrated to the evidence rather than the marketing on the bottle. A quick one worth clearing up while we're here, since it's been repeated so often it feels like an established fact. The idea that cracking your knuckles or other joints causes arthritis simply isn't supported by the research that's actually looked at it. The sound is just gas bubbles releasing within the joint fluid, not damage occurring. It may be an annoying habit to the people around you, but it isn't quietly wrecking your joints the way the old warning claims. Feel free to let that particular guilt go. And one more area worth a fair, honest word. Over-the-counter pain relievers and anti-inflammatory medications have a real, legitimate place here. They're not something to avoid on principle. Used appropriately and for the duration your doctor or the label recommends, they can meaningfully ease pain and let you move more comfortably while the underlying causes are being addressed through the strategies below. The caution is really about long-term, frequent use without medical guidance, since some of these medications carry real risks to your stomach, kidneys, or heart with regular heavy use, particularly as we get older. Used thoughtfully, as one tool among several, they're a legitimate part of managing this, not a crutch to feel guilty about. So, given all of that, here's what genuinely helps, and it should look familiar, because it connects to nearly everything else we've covered. Strength training, specifically targeted at the muscles surrounding a troublesome joint, is one of the most effective things you can do. Stronger muscles around your knee or hip take pressure off the joint itself and improve stability, often reducing pain meaningfully over a matter of weeks. This is yet another reason that resistance work deserves the priority we've given it, arriving here from a completely different angle. Losing excess weight, if you're carrying it, provides direct mechanical relief to weight-bearing joints, and the effect is often more noticeable than people expect, since every extra pound translates into multiplied force through your knees with every step. Keep the joint moving within a comfortable range rather than avoiding it entirely, since that nourishing, pumping action we discussed depends on regular, gentle motion. Swimming and cycling are particularly well suited here, since they move the joint through its range without the same jarring impact as running on pavement. Walking still counts too and remains a perfectly reasonable choice for most men. It's really high-impact repetitive pounding on an already sore joint that's worth moderating, not gentle movement itself. Lean your eating pattern toward the anti-inflammatory direction we discussed. More vegetables, fruit, whole grains, and healthy fats, less processed food and added sugar, as a genuine supporting piece of the puzzle. And know when it's time for a real evaluation rather than continued guessing. Persistent swelling, pain that wakes you at night, joints that feel warm or look visibly different from one side to the other, or pain that's steadily worsening despite these steps are all reasons to see your doctor properly rather than keep managing it alone. There are real medical treatments available, from physical therapy to medication to procedures, that can meaningfully help when the basics aren't enough on their own. If you've been quietly resigned to a sore knee or a stiff hip as simply the price of being over 60, I want to gently push back on that resignation. A great deal of common joint pain responds genuinely well to the right combination of movement, strength, and weight management, often more than men expect going in, and "it's just arthritis" is far too often treated as a full stop, when it should really be the start of a conversation about what can actually be done. You have more influence here than the fatalistic version of this story suggests, and it's rarely too late to start seeing real benefit. So, out of everything we've covered today, here's the one belief worth actually keeping, replacing all the others we just took apart. Inflammation itself isn't the enemy. Chronic, low-grade inflammation is, and the joint pain most men experience after 60 responds far better to smart movement, targeted strength, and sensible weight management than it does to rest, fear, or a bottle of supplements promising a miracle. Treat the actual mechanism, not the scary word attached to it, and you'll get further than most of the advice floating around out there. A final honest note. If your joint pain is severe, sudden, or accompanied by real swelling or warmth, please see your doctor properly rather than working through this list alone, since that combination deserves a real look, not a guess. If this cleared up some genuine confusion about your own joints, a like helps this reach the next man who's been told to just rest and wait it out. Subscribing keeps these honest breakdowns coming your way. Here's my question for the comments, and I'm genuinely curious. Which joint gives you the most trouble? And has anyone ever actually explained to you why rest might not be the answer? I read every one, and they shape what I dig into next. Since strength training came up again here as one of the real answers, my head-to-head look at cardio, strength, and balance work for men over 60 lays out exactly how to build that into your week safely. It's waiting on the end screen shortly, and linked in the description too. Move something today, gently, and I'll see you in the next one.